Namaste. Hello, everyone. I'm very happy to see all of you here today at our Facebook Live session presented by Apollo Hospitals. This is Dr. Srinidhi Chidambaram, and I hope you've all been safe and healthy. Today, we are going to talk about a term which, to many of you, this may be something that is new, but in the last few years, this word has rightly come to the forefront, and this word is self care. If you think you've been hearing a lot about this word self care now, you're right, because even according to Google Trends, the number of searches for this word self care has been quite exponentially increasing since 2015. So, what is self care? It means taking care of yourself so that you can be healthy, you can be well, you can do your job, and you can help and care for others, and you can do all the things that you need to do and accomplish in a day. Self care is not synonymous with self indulgence or being selfish, but it's very, very important. And this includes many things which we will discuss today, such as staying physically healthy, looking at your nutrition, looking at your physical exercise, seeking medical care when it is needed. It's really everything that an individual can do to manage all the stressors in their life and also take care of their health and well being. But this is really easier said than done because in a world where our time is not ours and we have so many commitments to our work, to our family, and all kinds of stresses, to overcome all that and then to keep working on self care is really something that is a skill that needs to be learned. So, to help us understand this and tell us what may be missing and how to consistently practice self care, I'm delighted to welcome Dr. Keerthi Pai, who is one of our most senior clinical psychologists, to give us her insights. Dr. Keerthi Pai has done her MPhil in clinical psychology from the KMC Hospital, Manipal, and a PhD from the Madras University. She's the consultant clinical psychologist at Apollo Hospitals, mental health advisor to the Apollo Shine Foundation, partner in the Element Psychological Support Services as well, guest faculty at the Institute of Mental Health, Chennai. She's a joint secretary of the TNACP, trained in marine psychology from Denmark, and is involved in psychological assessment and therapy for seafarers in Southeast Asia, and also a certified clinical supervisor from ACA Australia, trained in grief therapy, and also conducts regularly webinars on grief therapy for mental health professionals, trained in many psychological therapies like CBT, emotion regulation techniques, social skills training, etc. Welcome, Dr. Keerthi Pai. Thank you so much for joining this Facebook Live session on something that I think is a very, very important topic that not many people will be really aware of. So let's begin, first of all, by talking about what exactly is this word self-care and why is it important?
Right. It's very heartwarming to know that we as professionals are also talking about self-care and not only about focusing only on the physical health. When it comes to mental health, there is a large impetus on self-care, as you rightly said, Dr. Srinidhi, in the beginning, that there was a time when self-care was considered as selfish, or there were people who think that am I being too much obsessed about myself, looking into narcissism? No, self-care is absolutely nothing of that sort. Self-care is what we would basically try and help ourselves, because in the conclusion of what we look at is we are finally human beings who requires that amount of nourishment, nurture, and care to grow up into adults, grow up into resilient human beings, and psychologically strong, emotionally strong human beings. So the basic thing and that I think is a basic right for every human being to have this aspect of self-care, which I think is one of the most important stepping stones into looking at mental health.
So how does one really practice self-care or make time for it?
Can you repeat that question?
No, I was just saying that, like how does one make time for self-care in
Right,
our
right,
busy
right,
lives? And also, how do you really practice it? What does it
right,
involve?
right. So that's a very important question, Dr. Srinidhi. What we are looking at is, see, we have a 24-hour cycle. So every one of us, be it any part of the world, we have a 24-day cycle, right? Including both day and night, right? And we do have our house responsibilities, office responsibilities, responsibilities of children, other family members, extended family members, friends. So there is a constant bombarding of responsibilities, and especially now with the challenges thrown in by the pandemic, there are still more responsibilities and challenges being bombarded on each one of us human beings. It could be an adult, it could be a child, it could be an adolescent, or a senior adult. So we do have a lot of responsibilities. However, we also have to understand that we also have a responsibility to ourselves, right? Like how each one of our family members, friends, colleagues are important. Who is the most important person for you? Who is the one who is going to be with you all the time? Is it your child? Is it your spouse? Is it your friend? Yes, they will be there with you, but you are also the person who is going to be with you all the time, right? And that is the person you need to take care of, right? And you are the one who you were born with. That's the first breath you took, and that's the last thing you would do when you move away from this world. That's what we look at breath. And one of the main things when it comes to self care is also looking at simple aspects of breathing calmly. And as we move ahead, I would add on more aspects to it. But breathing is something which is very, very important to us. And when we are in connect to our body, that's one of the first things which comes in self care. Loving kindness to oneself. And these are all mantras which we've had in our Eastern philosophy. It's unfortunate that we have kind of conveniently forgotten all that, moved on with the Western philosophy. And when the West started looking at self compassion, looked at fMRIs and PET studies on Buddhist monks, they found that self compassion, starting from self care, self loving kindness, self compassion, all of that has a lot of effect on psychological health, mental health, as well as physical health. And that's when there was this big boom of everybody talking about mindfulness and moving on to self compassion and self care and so on and so forth. So it is there in our culture, and we are developing that into each one of us.
So, are there any simple steps that, for example, a person, I mean, let's talk about special situations in a bit, but a person who normally works from 9 to 5 and
Yeah.
has a fairly regular routine, what kind of activities should they do to foster their own
Right.
well-being?
Right. So when we look at, it could be a homemaker, it could be a working professional, it could be a human being of any age, any gender. Uh, what we need to again look at is, how are we going to manage our time? So we have time for cooking, eating, sleeping, and the story which I keep quoting, we have 24 hours, and in that 24 hours, there was a time when when this was a story told to me by my grandmother. Why is it they called having 24 hours? And what she told me is, we have an 8-hour cycle. So if you have 8 hours for studying or working, 8 hours for recreation, self care, in that all of this would add in, and 8 hours of sleep. But unfortunately, the 8 hours of professional work, 8 hours of taking care of family, 8 hours of other work, or maybe Instagram scrolling down, takes more than the 8 hours, right? And then what happens is, we hardly have any time left for thinking about ourselves. Okay. My question to each one of you viewers is, do you sit down at any point in your the day or night before you sleep, do you sit down at any time to think about yourself? You are worried about your children, your spouse, your parents, your colleagues, all over the world. There is so much to worry about. It could be weather, it could be politics, it could be what's happening around the world, so many things, right? Are we using at least a few seconds to sit down and be with yourself? How many of us are doing that? And that's the first thing which comes in self care. And I'm sure all of us have at least a minute for the most important person in your life, and that's you. So prioritize at least a minute in your life. It could be when you are traveling in the bus, or when you are sitting at home just before eating, or just before switching on the TV, or just before switching on your laptops. That 1 minute, that's where we start.
So in this 1 minute, what is so
Okay.
what should one really do? Like,
Yes. Okay. So we first start with that understanding and decision that this is the 1 minute that I am going to give to myself. Okay. So that, let's make that decision now, and that as a priority from today onwards. Then we are looking at how are we going to use that minute. You have 60 seconds, and if you look at it microseconds, we still have more time there, right? So that 60 seconds is very, very important for you to be with you. So I'll tell you this scientific study, Elizabeth Blackburn, who did this study on DNA. So what she found was, when people are involved in breathing exercises, mindfulness, meditation, it could be anything. What she found is that the telomeres, that those are the caps in the DNA, are the ones which help us when the cells split into more cells, right? So when the cells are dividing and becoming more cells, and as we grow older, the cells are also dividing and becoming more cells, right? So what happens is, as we grow older, the telomeres can fall off and disintegrate. However, what the study shows is that when a person is involved in mindfulness, meditation, even a bit of self care, there is integration of the telomeres. They don't disintegrate, they are there. And that is one of the most beautiful things about our human body, that the human body helps us to preserve our cells, our physical health, psychological health, and resilience. So it just takes about a minute. And what do we do in that 1 minute is, after we make the decision that just before I open the laptop, or just before I start cooking, or just before I start watching something on the internet or Instagram or on the TV, I am going to use that 1 minute to sit down wherever you're comfortable, or stand wherever you're comfortable, and look within. Many times it can be also difficult because we've never done that, right? We are constantly looking at outside. There is a lot of extraneous stimulus which can bombard us. We are also starting to look within. And that is when you can do this with your eyes closed, because it helps. You can also do it with your eyes open if you feel keeping eyes closed for a minute is difficult. What happens in that 1 minute is, you are being aware of your breath. And as I told you earlier, breathing is something which we started doing when we were born. That's the first reflex which comes in, and we don't need any training to breathe. All of us breathe, right? What are we doing in that 1 minute of self care is focusing on your breath, feeling your body. So we all know we have a body, we have a physical body. We are also feeling it. So we know that, okay, there is a breeze coming in, I can feel it. I am happy that I can stand up on my feet. I am happy that my heart and lungs and kidneys are working well. I am happy that I am standing here today or sitting here today. That's the first point of self care, where I am being with myself, and I am happy that I am being with myself. That's the first point. And that is what we would do in that 60 seconds of being with yourself.
Is there any, like, can you tell if somebody is not practicing self-care? So, what would be, those kind of symptoms that come out? And
Yes, yes.
how do you assess such a person?
Yes. So we are looking at the extent where we see a lot of, especially after the pandemic, we've seen a rise in mental health issues. We see a lot of panic attacks, depression, self harm, eating disorders, a lot of body image issues. We also see a lot of interpersonal relationship issues happening. Okay, people generally getting, even if they do not uh, fulfill all the guidelines of a clinical depression or a panic disorder or an anxiety disorder, mm, quite a bit of people who reach out and ask for anger management, anxiety management. Okay, so we see a rise in all of this. People, the level of tolerance has also come down. Okay, why are we getting into a society with less tolerance? Because we all have been living together. And what happens is, when I am comfortable with myself, I can also be comfortable with the other person, right? I accept as what I am, and that helps me to accept the other person as what he or she or they are, right? And that is where we also look at developing tolerance, developing that humanness, developing that unique feeling of being together, right? And we've always, human beings have always been thriving because we live together, right? And that is what we are bringing in. So it starts from self care, it moves towards being happy with oneself.
Now, let's look at some of the situations which are kind of extraordinary. So, for example, there are lots of people who now work like, in the night shifts. There are also a lot of people, not so many now, but there are some people who are still working partially out of home and things like that. So, all those are changes to the usual work is at the workplace, and home is a place where you relax. So how do those kind of people who don't have a regular schedule
Mm.
really, or do you have or have odd timings? How do they practice? So how can they? Any tips to help
Right,
you
right,
also do the self care?
right. um, See, all people do not have the privilege of having a 9 to 5 jobs and having a continuous work life balance all the time, right? What we look at is people can have different, so people can travel, people can work late nights, people would work on a US shift or Europe shift. So we all have all kinds of work timings here. And unfortunately, because the kids might come home late, so because after the work the moms have to stay back and provide them the food, so it's not just one person who's working late, it's a whole family who has to be awake, right? So that is where the self care comes in, right? So we know that this is something which we are going to face. So it need not be only in the night or only in the daytime that we are looking at. You can use that 1 minute, or you can even increase that time frame to maybe 5 minutes or 30 minutes, however, how much ever time you have with yourself, right? I would also want to have a demonstration if that's okay, Dr. Srinidhi.
Definitely,
Yeah,
absolutely. That
yeah,
would be
right, right. Okay. So I hope the viewers also find this useful, because this has been very useful for me when, when I see different, clients and patients with different difficulties. It can be also overwhelming because we have our neurons to mirror their pain and difficulties and challenges. So all of us go through stress, right? And it can come in different forms and sizes, right? And all of us do work in different timelines. So this is something where we look at self-care, right? So what we would do is, if I would invite each one of you to take 1 minute of your time to be there, starting from now, for self-care. And if you could all close your eyes, it helps you to look within. I prefer doing this closing my eyes because it helps me doing that, right? So we would take about a minute of our 24 hours day cycle for being with us. I would want each one of you to sit comfortably on your chair or on a bed or down, or if you're standing, stand firm wherever you are. Gently Breathe in and breathe out. As you breathe in, feel the air going in, and as you breathe out, feel the air coming out. Now feel your feet on the ground. Feel the sensation of your feet on the ground or on the chappal. It could be warm, it could be cold, it could be tingling. Feel your body touching the chair. Feel your clothes on your body. Feel how it feels when you are there, sitting or standing or lying down. Now, focus on any 3 sounds you can hear around you in the room where you're sitting. It could be internal sounds or it could be external sounds. It could be a bird, it could be vehicles, it could be a heartbeat or people talking. Any 3 sounds you can hear around you. And now gently bring your focus back on breathing. Now, gently take your hands and touch your heart so that you can feel your chest. And you can gently feel the sensation of your heartbeat. As you breathe in and breathe out, feel your hands, the warmth of your hands or the chillness of your hands, and the movement of your heart along with your breath. And as you breathe in, tell yourself, I am capable of being loved. And as you breathe out, feel your body loosening up more and more. As you breathe in, tell yourself, I am capable of being loved. And as you breathe out, feel your body loosening up more and more. Gently, whenever you are ready, you can open your eyes and stretch yourself.
That was wonderful, Dr.
Thank
Keerthi. I
you.
think that was such a useful thing for us to all remember and practice. So I think we've covered most aspects of it during this short session. There was just one thing which I wanted to just ask about new mothers. So they are again, or even the caregivers of people who are very sick. So these kind of people often, it's difficult for them. So how do they? I mean, is it like? I mean, I know you did say that you keep that 1 minute and then go on from there. So does it apply to them as well?
Yes, absolutely. What we've seen is when there is a secure attachment between the mother and the child, between anyone for that matter, because we are discussing new mothers, I brought in that example of mother and the child. What is a secure attachment? How does the secure attachment develop? Yeah, so we know that secure attachment is very important for the child to grow up into a resilient adult. All of that. There are so many studies on that. By Anna Freud, by Ainsworth. There's a lot of studies on that. What we are looking at right now is the mother and the child bonding. Okay. And that's the beauty of it. So because the child actually can feel the mother, because when the mother feeds the baby, when the mother is burping the baby, when the mother is keeping the baby along with her, it could be an infant, it could be a toddler, it could be a little more grown up child. Every time the mother is with the baby, the mother can regulate her breathing, and the child can also be there when the mother is breathing, right? And when you are regulating your breathing along with the child, both of you are equally being relaxed and taken care of. So, like how you have all the love and kindness to your child, we are also looking at you directing that love and kindness to yourself. And that's the beauty of self-compassion, self-care, and self-acceptance.
So I think we are running a little short of time. So is there anything else that you would like to share? And then we can close the
Right,
session.
right. So there's this important thing which I need to also share, because when we talk about self-compassion and self-care, there is a lot of books written, lot of research data which indicates that self-compassion has always been there in our culture, and it is very, very important for us to take it forward. And even if it is 30 seconds or 1 minute or 30 minutes, it's not, the time is not what we are looking at. It is the act which we are looking at, right? So what do we understand in self-compassion, self-care is that you need to have the, so we look at, if you look at Chinese, if we are looking at yin and the yang. If you're looking at Indian philosophy, we are looking at the, the male female, the ardhanarishwara, where we have the feminine side and the masculine side. So what we are looking at is, in self-care we also have to look at being kind to ourselves and accepting that there is some need to change. So if something is not helping us, if you're not sleeping enough, if you're not eating healthy, if we need to do the physical activity, so that's the change which we are looking at. So we are not stopping with being kind to oneself and being complacent about it. No, we are looking at being kind to oneself and also taking the step in a kind, gentle manner that, okay, now I need to do this for myself, because only if I am fine can I take care of my family, can I take care of my loved ones. So we are looking at the yin and the yang, the masculine, the feminine side of us, of all human beings, where we are bringing in the softness of kindness and the firmness of change. And that's the beauty of our life. So we have a soft heart and a strong back. And that is how the body is. And that's how the mind can be helped. And that's where we start on. So I would want all viewers here to take this pledge today, to bring in self-care is most important for them, and take us ahead as a world which is taking care of each one of you, each one of us. And that's the three circles which we talk about. So self-care starts with you, then the next layer of your family, it could be your spouse, it could be your children, it could be your friends, and then the third layer of the environment, so beyond the family. So these are the three circles which we talk about in self-care. So you begin with you, then your family, friends, and then the environment. So those are the three circles which we need to remember when it comes to self-care. So
Thank
all
you.
the best, and let's take this forward.
Yes, definitely. Thank you, Dr. Keerthi, for these very enlightening insights. So, dear viewers, I hope you found this session useful. So, please do take the pledge and start practicing self-care. Just from today, we've already had that 1 minute demonstration of what we can do, and we can expand it right from there. Of course, if you have any more questions and any more thoughts or comments, you can always post it on our social media channels, or you can reach out to us at any of our hospitals for assistance and help. Someone said, if you don't love yourself, nobody will. Not only that, you also won't be good at loving anyone else. So, loving really starts only with the self. So, let's start right today. Thank you and namaste.